All right, I think we'll go ahead and get started. Welcome everybody. Thank you so much for joining us today. I am so appreciative and so happy to welcome our WIPA experts who are with Disability Rights Iowa, and we have um, Misty and Tammy and Jenny, and they are just amazing resources. So if you haven't connected with them, I encourage you to know about them and reach out, when it's appropriate, because I don't think there are better resources available in Iowa, and probably much beyond Iowa and Illinois, actually. So I am going to turn this over to Misty in a minute, but I wanted to make a quick announcement because I actually will have to um, jump off before the end of the session. And so I just wanted to let folks know that our next community of practice is scheduled for March 13th, 1 to 2:30. We're doing some changes right now in our structure of how things are going to be working. I'm going to be stepping more away from things. And so we still need to kind of figure out what that topic might be and who might be leading that. So more information to come. We may end up canceling that as we sort out how things might look moving forward. But just kind of tentatively keep it on your calendar right now, and we'll get some information to you as soon as we have it. So uh, I just want to start by saying that in working with Kelsey Teeter with the Iowa Department of Education, one of the things for, well, a very long time that has come up in our conversations is really around the importance of good information and planning for youth in transition, and especially in thinking about employment and competitive integrated employment, and then addressing those concerns and those fears when it comes to threat to benefits. And so this session is really to kind of help engage in information sharing and conversation that's really focused on transition age youth. And so once again, thank you so much to the WIPA folks and to Kelsey. And if we need to dive deeper into these topics, because it would be helpful for um, those of us who are engaging with youth or supporting youth or families, please just let us know, because you're the ones who are having to kind of navigate in the trenches. So let us know where you need more information on things. But I'm just really tickled that the WIPA folks are going to address this today. So with that, I'm going to turn it over to you, Misty, and thanks again.
Thanks, Amy. Thanks, everybody, for joining us today. We're really excited to be able to talk to you guys about some transition strategies as they relate to benefits planning and some of the other supports that folks are tapping into. Quick introduction. My name is Misty Johnson. I'm the project director and community work incentive coordinator for our work incentive planning and assistance project at Disability Rights Iowa. I said that in one breath. I'm pretty proud of myself for just doing that, not throwing you all the acronyms. I've been working at DRI for about 12 years, been doing benefits planning probably since about 2009. I'm based out of the Clear Lake Mason City area, and before this world of benefits planning, I was a disability navigator for the Ticket to Work program, and in a previous life, a direct service provider, enclave leadership, that kind of a thing. So I've been able to watch what employment looks like from a 14C environment all the way up to community employment, self-employment. So it's super exciting for me to be part of the benefits planning team that helps people make those decisions. And I'm going to let my team introduce themselves. Tammy?
Hi, everybody. My name's Tammy Crouch. I work for Disability Rights Iowa, and I've worked here for 8 years. I've been a benefits planner for much longer. Previous to Disability Rights Iowa, I worked for Iowa Workforce Development, and then I was also a disability navigator with Misty. So we have a lot of combined experience with disability benefits. I'm based in Sioux City, so I'm on the western end of the state, and I want to apologize. I'm getting over this like crud that's going around, so I might have a cough drop in my mouth. So Jenny.
And I round out the trio. I'm Jenny Lyons, and I've been with Disability Rights Iowa about 3.5 years. Prior to DRI, I worked in higher education with students with disabilities. So it's been fun seeing the employment side and seeing some of the other barriers that individuals with disabilities experience across the state and how we can help them. And I am based out of the Cedar Falls, Waterloo area.
Thanks, guys. We at Disability Rights Iowa, we're going to touch on a little bit of things that we do there as well. And you can go to the next slide, Jenny, please. But we're a small piece of that pie, what we do. But today is going to be more about transition strategies, both what we do in that realm at DRI, what kind of benefits people can receive. Age 18 redetermination is another piece we're going to touch on. Social Security Disability Insurance, the SSDI work incentives, Supplemental Security Income or SSI work incentives, some touch on ABLE accounts, Ticket to Work, and how to refer beneficiaries for support from the WIPA project. And like I said, this is going to be kind of a higher level light touch on some of these things, but please let us know. One, if you have a question, toss it in the chat. We're going to be monitoring that as we go. And then we left time at the end for a whole bunch of questions. And then also, you know, be thinking about how we can help you and your team learn more about how to refer and what's available out there for benefits planning. Next slide. So like I mentioned, Disability Rights Iowa is the protection and advocacy agency for the state of Iowa. It's an independent nonprofit law center, but it's not a state or federal agency. And our main bread and butter is to provide free legal advice and advocacy assistance to Iowans with disabilities. We don't have a specific niche on what kind of disability. We serve all types of disability and all ages across the state. And some of our focus areas are listed here on the slide. There's us with the benefits planning assistance. We have direct individual legal and system change advocacy. We tap into education and empowerment, investigation and monitoring of facilities across the state. We do a lot of outreach and training, technical assistance, and we also house the representative payee oversight team that goes out and monitors both individual and agency or organizational rep payees. So a lot going on at Disability Rights Iowa. And again, we cover all 99 counties for Disability Rights Iowa. Next slide, please. However, the WIPA project is a little bit different than that. And we're going to talk about that here in a minute, what we all cover. So just to kind of get us rolling, let's talk about that definition of disability. And of course, this is Social Security's definition. So it may look different depending on what support or program you're looking at, but specifically for Social Security, that is both for SSI and SSDI, the inability to engage in a substantial gainful activity or SGA, and that's an acronym we're probably going to toss out a few times, so apologies in advance on that, because of a medically determinable physical or mental impairment that can be expected to last 12 months or that ends in death. It's kind of a harsh distinction, real strict, but that allows for people who apply for disability to have to fall into this category that they list. Next slide, please. So who are we? We're the Work Incentive Planning and Assistance, or WIPA, another acronym for you. Somebody has their bingo card, I hope. And what we are is a grant-funded program from the Social Security Administration who provides individualized benefits planning. Again, we are grant-funded through that. So when somebody is receiving a Title II disability benefit like SSDI or a child disability benefit, CDB, or a disabled widow benefit, or if they have supplemental security income due to a disability that falls under that, the age range is from 14 years old all the way up to full retirement age. And the other piece, and the key piece to remember, is that the person that we work with has to be interested in and actively looking for or already engaged in employment, or they could be doing self-employment or thinking about that. So somewhere on that employment continuum, work and employment has to be part of that conversation. So they have to be receiving or approved to receive those benefits, 14 years or older, and then also work has to be part of that conversation. Next slide. So some of the goals for the WIPA team are not only to improve outcomes for employment for the individuals that we serve, but to really increase economic self-sufficiency for those folks who receive Social Security disability benefits. Because we know nobody's getting rich on those benefits, and a lot of times people want to supplement what they're receiving or work their way off of benefits. We really want to enable beneficiaries to have all the information that they need that's accurate and current to make educated decisions about employment that meets the needs of where they're at and what their interests are. Next slide. So like I mentioned, the WIPA team specifically is a little bit different than DRI as the agency. The agency covers all 99 counties of Iowa, which we do as well. But as you can see on the slide there on the screen, we also cover 34 counties of that western kind of north part of Illinois as well. So about 120 some counties we cover. And that's the three of us that do that. There's other projects that cover the rest of Illinois. You can see them in the yellow and the red dot, but all of the blue area is all us. Next slide. So we're here to talk about transition today and what that really entails and why it's important for work to be part of that conversation. One, the earlier we're talking about work really creates that expectation of working, right? That really encourages independence and helps determine career interests. If students know that that's the expectation of work while they're in school and throughout till they're ready to do the next thing after high school, that can really build a good foundation for skills for future jobs as they're thinking about, building up their work credits, skills, different things like that. And again, also, we know that it's about who you know when you're landing jobs, right? So that helps to start that network for future jobs as well. A lot of times it's more about getting out of the house, learning new skills, learning how to navigate the world of work. And Social Security has a lot of work incentives that enable transition age students or youth to be able to do that and either maintain benefits or work their way off of benefits. It's not our job to decide that for them, but we really lay out a clear picture of what the different impacts may or may not be as they're looking at work earnings and benefits. Next slide, please. So just to kind of revisit, most of you folks on the call probably know this already, but we wanted to make sure and touch base a little bit. As I mentioned, the Title II disability benefits is where the SSDI, the Social Security Disability Insurance, lands, and also Child Disability Beneficiary, or CDB. And that's probably in the realm of transition where you're going to see most people under the Title II. If they're 18 and under, they're going to probably land here. And under that Title II benefit, that could include an auxiliary benefit, would be another way somebody is getting a cash benefit underneath this program. And there is definitely a different benefit amount based on work history. And we're going to talk a little more about that in a sec. And the other piece that's important to keep in mind with the Title II benefit is that people get Medicare along with that, but they have to wait 24 months before that kicks in. So that might be why you would see somebody receiving Medicaid that had a Title II benefit while they're waiting for that to kick in. And then the other program that we work a lot with is the SSI, or Supplemental Security Income. On that particular program, there are no auxiliary benefits, which is different than Title II, and they have a maximum amount that an individual can get each year, and that goes up with the cost of living adjustment each year. This year for 2025, and keep in mind, if you're watching this in a different year, these numbers will be different. For 2025, though, on an individual, the max amount they can get if they're only receiving SSI is $967 for an individual. And then for a couple, you'll notice it's $1,450, which if you do the math, that doesn't equal half and half. But that's what they have it set at for this year. And then for the resource and asset limit, $2,000 for an individual and $3,000 for a couple. And if you'll notice, there is no resource or asset limit under the Title II benefit for SSDI or a CDB benefit. And then the other piece is that SSI comes along with Medicaid, which is automatic in Iowa. That isn't the case for all the states, but our state, it is an automatic. You have SSI, you have Medicaid. Next slide, please. So part of our investigation when we are starting this benefits planning journey is to have somebody sign releases so that we can get this document. It's called a benefits planning query, or a BPQY. And really, it's a jumping off point for us as we are starting to investigate all of the moving parts that go along with benefits planning for a transition student. And that really encompasses comprehensive information about that individual's disability benefit and work status. Everything from what type of benefit they get, how much it is, what their work history is, what health insurance they're tapping into, and whether or not they have a rep payee. And I will say 96% of the time that these are not correct. So again, this is just a launching point for us so that we can get a feel for where the person is at as far as what Social Security has on their record. Because a lot of times that's not exactly the same as what the individual is telling us. So it's a great way for us to cross-check what the beneficiary has on their record and then what Social Security has on the record for them. And again, it's just a snapshot in time of what that work history and the benefits look like. They can change depending on when we pull this from Social Security. Next slide. So a little bit more about Social Security when somebody is under the age of 18. So most Social Security beneficiaries who under age 18 are going to be receiving SSI. And while it's kind of uncommon, an individual who's under the age of 18 who's working could qualify for the SSDI benefits. And we linked in there how a person would qualify for the Title II benefits off their own work record. It's kind of a little bit involved with having to work so many quarters and earn so much. So we linked it in here for you if you guys want to take a look at that. An individual who's under the age of 18 can receive also, though, an auxiliary benefit off of somebody else's record. And that would be somebody like a parent or an insured worker who's retired, receives disability benefits themselves, or who has passed away. They could pull off of their record as well as an auxiliary benefit until they're age 18. And also, if the individual acquires a disability before the age of 22, that's where that CDB or childhood disability beneficiary piece could come in, because then they're pulling off that parent's work record. Next slide. So a lot of times when somebody's about to turn age 18, we're talking to them about taking a look at whether or not they're going to be eligible for the benefits. So when we do that, there is a process called age 18 redetermination. So if somebody's receiving SSI and they're going to be turning age 18, they have to have their eligibility reviewed. And it would be just compared to like applying completely brand new as an adult. Because before age 18, Social Security would look at their income and household with their parents as well as their earnings, where once they're 18, they're their own entity, their own household. And they have to really match up not only to the adult definition of disability, which is different and based on ability to work and earn money, like I mentioned earlier in the slides, but that is also, something that could look different for a lot of students. And we have the stat on here as well on the slide, is about 50%, a little higher, of Social Security or supplemental security income Recipients who go through that age 18 redetermination may not be eligible as an adult under the SSI program because of the way that Social Security defines disability. So there's definitely kind of a gap in there as to whether somebody is going to be able to be eligible once they turn 18. Next slide, please. Okay.
And I think I'm going to be taking over.
And jumping in, we'll turn it over to Jenny.
So we're going to break down, as Misty outlined, there's two major programs, the Title II side, which we often just call SSDI, and then also SSI. So I'm going to touch on some of the work incentives under Title II. As Misty said, we're going to do a light touch. If there's a specific work incentive that you'd like us to come back and talk about, or if you'd like us to come talk to your organization, we would be happy to. But just to start off, there are a lot of different work incentives for someone who's receiving a Title II benefit. And we're not going to touch on all of them, but we're going to highlight a lot of the major ones that we often see. So because this is so confusing for a lot of individuals, we created this graphic a couple years ago to help individuals better understand what this work incentive road trip is, which is what we call it. So we're going to break down this road trip starting from the Traveler right before the Stones all the way to the ocean, sea, and everything in between. So if we're talking to someone and they are, let's say, at the very beginning of starting to work, they have SSDI, they haven't worked since getting benefits, and they're now thinking, I really need, for a variety of reasons, to get a part-time job. So the very first part, if we're trying to get from, like I say, Iowa to Virginia, we're first going to go through the trial work period, or TWP. And that's where for 9 months, someone can earn as much as they want, and there's not any ceiling or cap to how much they can earn. During those 9 months, nothing changes with their benefits. And the reason why this is so powerful is it allows someone to test out work, especially if they don't know what they can and can't do anymore. Maybe they were working in a completely different field, and due to their disability, that's not an option. Maybe they used to work full-time and they don't even know, can I work part-time? Can I go back to full-time? So it lets them test out work, try different jobs at different levels to see what does and doesn't work for them. Now, in order to use one of those 9 months, which on the graphic, we have the Traveler right before the Stones, you'll see there's 9 stones for each of those months. So in order to hop onto one of those stones, you have to earn at least a certain amount. So for 2025, someone has to earn at least $1,160 gross in a month. So I like to say, if let's say someone gets a part-time job, they're earning $800 gross in a month, Social Security isn't going to say that they've even left on that trial work period left. They've thinking about starting on the road trip. They're at Quick Star, debating should they get the Dots pretzels before they hit the interstate. So if someone, maybe they're starting small, they still have these 9. You don't use those 9 until you use at least, or you earn at least that certain amount, the trial work period amount, in a given month. Now, the nice thing is these 9 months aren't necessarily consecutive either. So maybe someone starts a job in January and they work for 2 months and they're like, this was way too much. I was earning $2,000 every month and that was just too much for my disability. They would likely have used 2 trial work months, January and February, but maybe they take a couple months off and they try a new job. And so that's where they don't have to, just automatically be, yep, I'm using it now. It's dependent on how much someone's earning. Now, the nice thing is someone isn't just eligible if they're doing wage employment. They can also tap into it with self-employment. Social Security looks at the same number, that 1,160. They do an extra calculation since they know that someone who's self-employed has some additional taxes come tax time. And that's something that we'd want to discuss with someone who's interested in self-employment. Social Security also knows that even though someone might not be earning that $1,160, they may be putting in that same amount of time. And so if someone works at least 80 hours in a month towards self-employment, that would also count towards one of their trial work period months. So there's not any ceiling or cap during this time. Social Security is just looking, are you at least earning a certain amount to use one of those 9 and essentially hop onto each of those stones. Now, Misty talked about that substantial gainful activity. And just to dip into that a little bit more, that's where an individual in Social Security's eyes is performing significant mental and physical duties for profit. The definition of disability under Social Security is all about work. So for Social Security, that demonstrates that that person with a disability is able to work despite their disabling condition. Now, if someone is going to ask us, and remember, this is in 2025, so if you happen to be watching this in a future year, please go online and check for those new numbers. But the easy one-stop answer, if someone were to ask, what is that SGA amount? If someone is not considered statutory blind for Social Security, for this year, that's $1,620 gross in a month. And if someone is considered statutory blind, that's $2,700 gross in a month. And just a reminder, gross is before taxes. Social Security considers everyone has to pay taxes, so they're looking at the gross amount. Now, even though if someone were to say, hey, what is that 2-second answer for, how much someone can earn after their trial work period? That's where we would give the SGA number. However, SGA is more than a number, it's a decision. There's a lot of complex considerations that Social Security takes into account, and a lot of the work incentives that we're going to talk about goes into that consideration. So while we can provide that very easy answer, we are always quick to say, everyone's situation can be different to where someone could potentially be earning over the SGA amount and still eligible because they can tap into different work incentives. So we're going to go with, just for this initial conversation, looking at that number amount, but knowing that there's way more involved to it because everyone's situation is a little unique. So if someone gets through their trial work period, whether they started a job and used them up right away, or they tested out different jobs over time and used up those 9, my analogy from Iowa to Virginia, they made it to Ohio. So that's where Social Security has started a new phase. And that's what's called the Extended Period of Eligibility, or EPE. And that's where our traveler, if you see on the slide, they're no longer facing, the different rocks to hop onto. They're now at the boardwalk. And that boardwalk, if you were to count, there are 36 boards, and that represents the 36 consecutive months of EPE. So let's say someone's trial work period ended in June. The very next month, in that example, July, would start the extended period of eligibility. And that would go consecutive, boom, 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 3 years for that time period. So unlike trial work, it is consecutive. Now, the nice thing, while someone's on this boardwalk, their Medicare, if they're receiving it, if they've gone through that 2-year wait, like Misty mentioned, they're going to continue regardless of whether they're getting a cash payment. One of the major questions that we receive, especially if someone does want to eventually work off benefits, is what's going to happen with my healthcare? And the nice thing is healthcare is typically the last thing that will ever go. They will lose their cash payment before they would lose health insurance. So that's something that we really like to highlight because we know that health insurance piece is often the most critical part for a lot of individuals. So during this boardwalk time, as you see, we have color coded it. So I like to think about SGA, remember that number, we're going to use that number, but there's a little more to it. If you're going 60 in a 65 zone, no one should care. If you're driving 70 or 75 in a 65 zone, someone's eventually going to care. And I like to say Social Security is always going to eventually care. So if at any point during this EPE time while they're on the boardwalk, if they earn under the SGA amount in a given month, they're still going to get their cash payment and nothing's really going to change. They may not even know that they're in EPE time if they're earning under the limit because everything's going to look the same. Now, if someone earns over the SGA amount, that's where eventually their cash payment is going to be paused. So as you can see, the first part of this boardwalk is all brown. So if someone's getting their cash payment, they're earning, let's say, $1,500 a month, things are going great. And then partway in, they get the opportunity of a promotion, comes with an increased raise, and it's going to now put them at $2,000 a month. And that person has decided, you know what, I want to try for it. I want to go for it. So they take that promotion. The very first month that someone works over the SGA amount, that's Social Security gives a very just fun name. It's called cessation. Really, it just means that's the first time you ever earned over SGA, and you still get a check. And you still get a check 2 more months, so 2 grace period months, where you still get a check. So it's essentially a 3-month period, this blue on the boardwalk, where someone is earning over SGA and they still get a check to help them transition to their check being paused. Now, this period after this grace period, all this gold, that's where someone's earning over SGA and Social Security has paused their check. Now, the nice thing is, let's say something happens, they get to this like 6th or 7th board and something changes with their health and disability. They can let Social Security know, and Social Security, if the person's no longer earning over SGA, can get their check restarted. And that's a really great safety net, essentially, because a lot of times, even if someone wants to eventually work off benefits, they want to know that it's not just all of a sudden going to go away, that there are steps along the process where if something changes, because anyone knows that their health can change at any time, they can get back on that benefit just to be able to cover their basic expenses. Now, the nice thing, like I mentioned, with Medicare, that's going to be the last thing that'll ever go if someone does want to eventually work off of benefits. If someone's still getting a cash payment and they're like, you know what, I'm just wanting to work part-time, supplement my income, they're not going to see any changes. Now, if someone does want to work off of benefits, they will have Medicare coverage at least 93 months. Now, I say at least because there's a complex calculation that Social Security does when someone's terminated to determine how long their Medicare will go. But Misty, Tammy, and I have all worked with individuals who they will have Medicare years after they're terminated due to this work incentive. So if someone has questions about this, we would really want to talk to them so we can estimate in their situations, because there's a lot of pieces that go into it. Now, we do want to highlight one great option. If someone does have a Title II benefit and they're receiving Medicare, they could be eligible for a way to get Medicaid called Medicaid for Employed People with Disabilities. So if you've seen us present before, you might have heard Medicaid is like a house. And so one of the ways to get into the house of Medicaid is through MEPD. So this is a great work incentive if someone's between ages 18 and 64. I apologize if you hear my lab. I think the postman is here, or the post worker is delivering our mail. This person who could be eligible for MEPD has to be working. Now, they don't have to be working a certain amount. It doesn't say that they have to be working full-time, as long as they have some type of income, whether it's, they're cutting their neighbor's lawn every month, they're watching their friend's kid, or they could have a, part-time, full-time job, just depends on their situation. Their countable income has to be less than 250% of the federal poverty level for their household. And it does come with a higher resource and asset limit, $12,000 for individuals and $13,000 for a couple. And it does exclude retirement accounts, which is really nice because a lot of people we work with who are receiving a Title II benefit have had retirement accounts from previous work from before they became disabled, and they don't have to worry about having to spend those down in order to access MEPD. Depending on how much someone is earning every month, there might be a premium for MEPD. We do include a link to the MEPD page for additional information that does include that chart that outlines how much someone's premium would be based on their income. So as I've hinted at throughout my part of the presentation, there's all these work incentives that someone might be able to tap into that decreases their income under that SGA amount. So one of the big ones that we run into a lot is impairment-related work expenses, or IRWEs. So for an IRWED account, it has to be an item or service to enable that beneficiary to work. There has to be that work component with it. It needs to be an item or service that they need due to their disability. And the cost is paid by that individual and isn't reimbursed. So not reimbursed by any of their health insurance, vocational rehabilitation, any other employment network, or any other service or provider that they have. So something they're paying out of pocket for their disability in order to work. The expense also has to be reasonable. And you'll see we noted that does not mean cheap. So if someone, let's say they need a certain assistive technology device, and maybe the only options for that person, either based on their disability or in general, maybe it costs $500. If that is the one that someone needs, that is reasonable for that price, that could be considered an IRWE. Now, if someone, let's say they need a certain assistive technology and they could get something that's 100, or they could get something that's 1,000, and it's, I really just want the 1,000, the $100 one would totally be reasonable and I could use it. That's where that $1,000 might not be reasonable. But just because something's more expensive doesn't mean it can't be an IRWE. It just has to be reasonable for what the person needs and that device in and of itself. So the beneficiary would need to submit receipts to Social Security, and Social Security would determine if they would approve that as an IRWE. Now, the nice thing is that applies to the work incentive, the program that I'm talking about, Title II. But in a minute, Tammy's going to be talking about SSI, and that IRWE applies for that program as well. Now, it is important to note that IRWEs only count once that trial work period is over. As a reminder, you can earn as much as you want during the trial work period. Social Security is not looking at that SGA until you're on the boardwalk. So if someone knows that maybe they're having to pay $100 every month for medication, Social Security would say, hey, keep those receipts. Once you hit EPE and after, that's when you can submit them. During trial work, earn as much as you want, nothing's going to change. So if you're working with someone and they're saying things that, they have to pay out of pocket due to their disability to work, that may be an IRWE. Now, those IRWEs, there's not an exhaustive list. It's like accommodations. There's not this secret list of this is what's an IRWE. Some of the most popular ones, or common ones, I should say, that we see, it could be attendant care services, counseling and medication, other medical service devices, over-the-counter items. Maybe someone has migraines and they use Tylenol every day. Even though that's not a prescription, that could still be considered an IRWE if they need it for their disability and to work. Service animal, if anyone has a dog, they know just from being a pet owner how much cost that goes in. But if someone then on top of that has a service animal, there's additional training, there's other expenses that come with that, and that could be considered an IRWE for that person, which would really bring their countable income below that SGA amount. Now, we mentioned transportation. That could be an IRWE. It depends on a lot of factors and the person's situation. So if someone has concerns about transportation or certain costs, we'd want to talk to them to know what's going on to determine could that be considered an IRWE. Also, supported employment services and other work equipment could be considered an IRWE. We like to say, if you're thinking it might be an IRWE, submit those receipts and see, because the worst thing Social Security can say is no. But everyone's situation is unique. So just because it may be something we haven't seen doesn't mean that it couldn't be approved. Another powerful work incentive, and I would say this is probably one of Tammy's favorite, I know she works with this a lot, is called a subsidy. Now, a subsidy is to support an individual receives on the job that may result in them receiving more in pay than the actual, quote, value of the services they perform. And this one can be really tricky to understand, especially from an advocate standpoint. But really what it means is that employer is willing to provide different accommodations and support for that employee and still pay them the same regardless of if they need additional breaks or maybe they can't perform all the duties on the job. So some of the examples to help maybe explain it a little bit better, maybe that beneficiary, there's 100 tasks. So anyone who's employed in that job would have to do 100 different tasks. But for this person with a disability, they can only do 80 of those. Those other 20 they can't do to their disability. Now, instead of paying that person less, the employer says, you know what? You focus on those 80. You're really good at those. Don't worry about those other 20. Now, that's where Social Security can look at the situation and say, hey, employer, you're being supportive. You're providing essentially a 20% subsidy. So that's where Social Security could essentially not count 20% of someone's earnings, because in another job, that employer could say, we're going to pay you less because you're not doing all the tasks that typically someone would do. Another one could be someone receives more breaks. So maybe someone gets 2 50-minute breaks during their shift, but that person with a disability needs 4 15-minute breaks. So that's where, because they're taking more breaks, the employer, instead of saying, hey, we want you to clock out, you're not going to get paid as much, they might say, just take that break, no worries. We're still going to pay you the same because we know that you're a good employee and we want to support you. So Social Security would look at, and the value of someone's work wouldn't necessarily be reflected in how much they're actually getting paid. So this is really powerful because it can really bring someone's countable income under SGA and provide that essentially an extra support that they need in working. Now, some of the questions, there is a form that the employer would fill out to be able to identify that there is a subsidy, but does the employer or employee complete all the usual duties for someone in that position? Does the employee regularly report to work as scheduled? Maybe that person needs to take off extra time due to their health, and the employer says, you know what, that's fine. You can have additional sick days and we'll still pay you. Or does maybe the employee take more time to be able to complete tasks? So this is where the employer, because they're providing those accommodations, can show that there's a subsidy. And we can talk with that employer, because sometimes this is confusing because it sounds like you're saying, you know, oh, the employee's not a good employee. And it's like, no, you're being a good employer and providing support. Social Security is just showing that if maybe they work somewhere else and they weren't getting that support, they wouldn't be earning as much. And so they're trying to take that into account. Now, let's say someone gets through the boardwalk and they are at the very end. So they've gone through those 36 months. In my analogy, they've made it to Virginia. They're standing at the end of the boardwalk. Now, if at any point after the EP time, if someone is earning under the SGA amount, their cash benefit is still going to be paid out. And they're just going to be like the person in the graphic, essentially sitting on the end of the dock, enjoying the summer day. Now, if at any point that person decides, you know, hey, I'm going to earn over the SGA amount, that is when they would be terminated and they're essentially jumping into the ocean to go swimming. So this could be, you know, right after, if their benefit is paused and they're still earning over SGA once EPE ends, they could be terminated right away. Or it could be, let's say, 5 years down the road when they get a promotion, they're like, you know what, I'm going to go for it. It's at any point between the end of EPE and their retirement age. Now, there is a way to get back on their benefit if something changes with their health. So it's called expedited reinstatement. So if a beneficiary's benefits were terminated because of work and their earnings, and they had earnings over SGA after EPE, they can request for their benefits to restart without having to go through a new application and acting like, you know, it's ground zero, start at the beginning. So that person has the ability to swim towards that boat, which was labeled EXR. So a couple important things. The beneficiary can request that their benefits restart if they were terminated, one, due to work. They didn't have a medical review and found that they medically improved. It's because they were working, that's why they were terminated. They're no longer earning SGA in the month that they request reinstatement, and in general, moving forward, they're not earning over SGA. And that disability has to be the same or related to the same one they had when they were receiving benefits. So my example I like to give, let's say someone was diagnosed with cancer, started receiving SSI or SSDI, and then they got better, they worked off of benefits and were terminated. Now, if, let's say they, 3 years after they were terminated, they were in a car accident and have a different disability, that's not the same or related to the same as when they were originally on benefits. So they would have to submit a new application. But if in that person's situation, maybe they had complications from their cancer treatment or their cancer returned, that's where they wouldn't have to go through a new application. They could contact Social Security and Social Security would initiate a new medical review, which is a different and lower barrier than if someone was applying for the very first time. Now, the nice thing is someone has 5 years after they are terminated in order to access expedited reinstatement, and they can receive up to 6 months of provisional payments while Social Security is making that decision about whether they can get back on benefits. And if ultimately Social Security decides, nope, you're not considered disabled anymore, they don't have to pay those provisional payments back. So we have this as a graphic that we like to give out. So if you're working with anyone and you're like, this would be really helpful to have, we would love to be able to send this to you, because just being able to see a visual often is a lot easier to be able to understand what we call the work incentive road trip. So while I wrap this up and I pass it along, I do want to highlight self-employment. Now, self-employment, there's a lot of pieces to it. As I mentioned, Social Security is going to do a little calculation on someone's net profit to then determine what their gross earnings are. So they'd look at how much income do you have coming in minus any expenses, and then they would take that times 0.9235, because they know about 7% is going to be counted for these taxes come tax time. Now, it's important for anyone who has their own business to be tracking their hours they spend working, along with that profit and loss statement every single month. And then come tax time, they will want to submit their tax returns to Social Security. Now, there's a couple work incentives that they could tap into as a business owner, including averaging of income, unpaid help, and unincurred business expenses. We're not going to do a deep dive today on self-employment. We would love to come back if that is something that more people would want to know about. But we really, if someone's interested in self-employment, whether starting their own business, food truck, if they want to do gig employment like Rover or Instacart, we would want to talk to them, just because that can get a little more complex compared to just general wage employment. Now, I'm going to actually pass this back to Misty, and she's going to talk all about SSI. And everything I said, just do a pause, because SSI is a little bit different.
Thanks, Jenny. Yeah, absolutely. Kind of set that in a little compartment over here, and let's talk SSI. And with transition, this is where you're going to probably see more people in, especially if it's a student between age 14 and up to 17. A lot of times with the SSI piece, that's where you're going to see it more so than not. So some of those work incentives that come along with SSI are the earned income calculation, which I'm going to show you here in a minute. The impairment related work expense, or IRWI, which Jenny mentioned, still can be applied with SSI as well. And of course, one of my favorite work incentives, the plan for achieving self-support, or a PASS, a student earned income exclusion, a 1619B, and the blind work expense. Next slide. We're not going to dig into each one of those, but we're going to touch on some of them. So let's talk about what comes along with the SSI medical stuff. As I mentioned early on in the presentation today, SSI in Iowa automatically comes with Medicaid. Because Iowa is a 1634 state, that's available to all SSI recipients. Like I mentioned, automatic, no waiting period, and it's kind of the default over the other eligibility groups that come along with Medicaid. Some of those other eligibility groups, like Jenny mentioned, Medicaid's like a house. You got to find your right door into it. And based on that is due to their income and resources and where that person could best fit under those eligibility groups. And the other big caveat is that it can pair with Medicare benefits and would pay the Part B Medicare premium if somebody's receiving Medicaid and Medicare at the same time. And like I mentioned, there's different coverage groups. We linked it here to the HHS website for the different rules and the eligibility groups that are available. Next slide, please. So like I mentioned, with SSI, there's the general exclusion and earned income exclusion. And this is applied for anyone who receives SSI. So from 14 and up, all the way to retirement age for SSI. So part of that is a general exclusion that Social Security disregards the first $20 right off the top of any unearned income. Or if they're don't have any unearned income, that comes off later in the calculation. So also there's earned income exclusion. So Social Security will disregard the first $65 of earnings, and then they divide it in half. Next slide. Let's take a look at what that looks like. So here's a pretty simplistic example. If somebody is earning $885, they would get first that $20 exclusion, then the $65 exclusion comes off, then they divide the rest in half. So in this example, they're really only looking at $400. And a lot of times there's myths about how much actually gets counted when somebody's doing a calculation for SSI. So this is a great way that you can show people that you're working with how this works. So $400 is the base that would reduce what SSI is going to be recalculated at. And you'll see in this example, this person is still going to get a $567 SSI check plus the $885 of gross earnings. So their total income goes up to $1,452. And we always like to say that most people are going to come out ahead when they work and have SSI. A lot of people really get stuck on the fact that they're going to lose, using quotey fingers, lose SSI. And yes, your SSI will be reduced, but you're making a lot more money working than you would be in just having SSI cash benefits. Next slide, please. So let's move into a little more student-related things. So the first one I wanted to talk about is a student earned income exclusion. So the biggest piece of that is the person has to be under 22. They have to regularly be attending school, and that can look different as far as where they are in that education level, from a training course at 12 hours a week to college at 8 hours a week. And if they're in high school, it's at that 12 hours a week level. And home study can count as long as they're home study due to disability. And that really allows the student to exclude quite a bit of earnings per month that don't have to go into that calculation that I just showed you. And that could be up to $2,350 for this year. So they could literally make that much money, $2,300 and some change, and not have any of that count toward their SSI. So ideally, in that situation, a student could be earning the $2,300 a month and still get a full SSI check up to $9,460 annually. And that's for 2025, remember. So if you're listening to this at a later date, remember that the numbers are going to be different. But it's super important that you notice that there's a lot of moving parts in this. The student can work and have that completely excluded. Because I don't know if there's many 14, 15-year-olds making $2,300 a month, but there could be, and which is great because not only are they earning that money, they're also starting to earn the work credits, which is super important if they are thinking that SSDI might be an option down the road. Next slide. So another piece I mentioned was the 1619B. And because Iowa is a 1634 state, this work incentive is pretty awesome. And what it really means is if an SSI beneficiary reaches what we call break-even point, so they've earned enough money to get that SSI cash benefit to zero, and that's what it shows here on the slide, then they're still entitled to Medicaid. That if they earn all the way up to the Iowa threshold for this year, which is the $52,860, they can still get Medicaid and work at that level. Of course, they still have to meet all the other requirements for SSI, like the resource and asset limit, and they still have to actually need or meet the disability criteria. But like you can see in this example, somebody could be making up to that much and still get Medicaid, which is super important for a lot of folks. Next slide. And the other thing I should mention about 1619B is that's an automatic Social Security thing. So sometimes we have to cross-check whether or not it's being applied just to make sure they're in the right criteria. If somebody per se got notified that their Medicaid was going to stop, we want to make sure that the two systems are talking to each other because it does happen once in a while. So the other really big thing that we see a lot for transition age students is Section 301, which really in a nutshell means that that person can get still their payments to keep going if they have an open program or plan. So if they're working with vocational rehabilitation, if they have an open pass plan, if they have an open IEP, something like that. If they were determined no longer to meet the medical qualifications through a medical CDR, continuing disability review, or if they went through the age 18 redetermination that I mentioned, if they are doing that and have the open program like we talked about, Section 301 can be applied so that they can keep that baby going until they complete that program or their plan. And the really important pieces of that is this applies to both SSI and SSDI, and they have to continue to meet the SSI eligibility, resource asset limit. But this only offers to extend the benefits that have been terminated due to that medical recovery versus that their earnings are high enough to be able to not get the benefit. And again, this allows continued payment of the auxiliary benefits for the folks who are doing the Title II or SSDI benefits. And that also means that the Medicare and Medicaid continues. And the biggest piece is that still has them the ability to maintain the right to appeal that medical recovery decision that's been made. So a lot of moving parts there. But the one thing I will mention is this is not necessarily automatic. So somebody may get a medical CDR and be notified they're no longer disabled due to the medical recovery or their age 18 redetermination. And they're going to want to let Social Security know that they still have that open VR case file or open IEP, or they're still doing a pass so that they won't close out their cash benefits. Next slide. So here's my favorite work incentive above the all is the plan for achieving self-support, or a PASS plan. And what a PASS plan is the a savings way for a beneficiary to set aside income or resources to a specific account to help them achieve a vocational goal. And that vocational goal has a couple of things that it has to kind of check the boxes. It has to be a feasible or attainable goal. It has to be expected to at least decrease the need for an SSI cash benefit or enable an individual to work their way off of benefits altogether. And some examples could be even, gain independence, increase work hours, reduce job supports like job coaches. Really is something we can talk through as to what that vocational goal is. One thing that I really want to mention that I think people don't know is that they can start as early as age 15. So when we're talking about transition age students, we really want to be talking about this particular work incentive because it's a great way for somebody who's working in school to be able to set aside money. Maybe they need to save for a new car, or maybe post-secondary is their goal and they want to start saving up money for tuition and books. This is a great way to start early and be able to do that. And the other important facts too about a PASS plan is the person has to already be receiving SSI or be able to be made eligible for SSI. So in other words, it can work for somebody who's receiving SSDI. We just have to kind of figure out whether or not their budget will allow for them to only receive the $600 or $967. That's the cap of the SSI. And the other piece of that is they have to have some kind of income or resource to set aside into a PASS account. So if they're not having anything reduce their SSI, like work or child support or something like that, then they wouldn't be able to do a PASS because they don't have anything to set aside. And the other thing is we always want to look at the budget. We want to make sure they're not going to have to dip into the PASS account money to pay their bills each month. They want to be able to be successful and financially secure when we're doing a PASS. Next slide. Some other things about the PASS that are kind of cool, and people may not know that you can utilize the PASS account for a lot of different things. Again, it's got to be based off that vocational goal, but it's a wide range of things we can write it for. Everything from attendant care to education and training. We've done a lot of them for tuition, books, fees, and if I can help somebody reduce their student loan debt, I am all for it. Another piece of that is the self-employment piece. You can utilize a pass to build up capital for a business. You can use it to buy equipment for your business. And it's a standalone from, let's say, of Iowa Vocational Rehabilitation match, but you can use the pass funds to meet that match for voc rehab. So that's something that's kind of unique to a pass. The other piece of that is we can also use a pass for vehicles and related expenses, tax, title, maybe insurance while the pass is active and going. It's really a non-exhaustive list, and if you can write it, we can kind of figure out what that looks like. And those get sent off to a pass specialist at Social Security who does the approval process for that. Next slide, please. We are doing a lot of pass plans with our WIPA project as of late. Iowa is one of the top ranked pass plan states in the country, and we're pretty proud of that. And just to kind of give you a quick breakdown of what that looks like. So this scenario on the slide is what your earnings or student earnings would look like without a pass. So if they were working and the general exclusions happened, the earned income exclusions, like we mentioned, they're going to count about $400 of that. So that total gross income with their SSI payment is the $1,452. But if somebody does a pass plan, next slide, please, it can look like this. Although that bottom line is still the $1,452, you're going to notice that something is being set aside into the pass plan every month. And that's the part that is countable earnings from work. So the part that usually reduces the SSI cash benefit is now getting set aside into a pass account to start saving for those expenses, which means that individual gets a full SSI check and still gets the other part of those earned income. So it really comes out to be a benefit for that person, and in a lot of cases can really be fast in how quickly they can save toward their vocational goal. Next slide. So another great way for people to save that doesn't impact, and I should mention about the pass plan, that also the money in a pass plan is invisible to SSI, Medicaid, housing, and food assistance. Same as an ABLE account. When somebody uses a tax advantage savings account that is the ABLE accounts, they do not count against any of those needs-based programs like I mentioned, SSI, SNAP, or housing. And it's utilized to cover any qualified disability expenses. That's where the ABLE accounts and pass accounts are a little different, is that in an ABLE account, the qualified expenses can be a wide variety of things. You don't have to narrow it down to be meeting a vocational goal like you would with a pass plan. An ABLE account, as long as it's connected to health and wellness and disability, then it could be an allowable expense. So some of those things that we want to talk about ABLE accounts is that individuals this year for 2025 can contribute $19,000 a year. Excuse me, and beneficiaries who are working can contribute even a higher amount, an additional $15,060 a year. So that's a lot of money that can be set aside into an ABLE account that is totally excluded from those needs-based programs. Next slide, please. So let's talk eligibility. People who are diagnosed with a disability before age 26, and one of the following is true. So either they have to be eligible for SSI or SSDI due to disability, or experience blindness as determined by the Social Security Act, or have a similarly severe disability with a written diagnosis from a licensed physician that can be produced if requested. So in a nutshell, what that really means, if you're already receiving SSI or SSDI and that your disability started before age 26, that would mean you're eligible. Or if you can put your hands on that diagnosis that's written from way back to be able to provide if you're audited, then that counts as well. And what's really cool is this is the last year that somebody has to have disability before age 26. Next year, that age gets bumped up to 46, which is great because we know that a lot of people are acquiring disability much later than age 26. And this will open up the floodgates for ABLE accounts, because we know right now there's about 6 million more Americans that can tap into ABLE accounts once this age changes next year. Next slide. And like I mentioned with expenses, as long as you can tap that back into or related to disability, health, and wellness, really there's not an exhaustive list. It could be everything from assistive technology to financial management to housing. Like with a PASS plan, you can't use that for housing, but with an ABLE account, you can. You can save in here to save up and buy a house, or utilize it for rent if you need to, and transportation fees as well. Next slide. As long, like I said, as you can tie it back, you're good to go. The other thing that's unique about Iowa is any resident paying taxes in this state who is a resident can, excuse me, and who contributes to somebody's ABLE account can deduct that contribution from their adjusted gross income this year. And that's up to about $5,800 for 2025. Excuse me. And those account assets grow deferred from federal and state income taxes. The withdrawals from it are tax-free as long as it's used for one of those qualified expenses. If it isn't, then you're going to be taxed on it. Next slide. So we gave you a couple links here that you can tap into for how to open an ABLE account, for the iABLE. And then also we included the National Resource Center, where you can put a couple of different states in there and utilize their compare tool, because even though you're a resident of Iowa, you don't have to use Iowa's ABLE account. You can use another participating state as long as you only have one ABLE account active at a time. And just remember that ABLE accounts only protect the individual's assets. The individual's earnings are still counted toward SSI, Medicaid, and the like that. Next slide. So we wanted to touch a little bit on ticket, because as you can see, the age range kind of falls in there for transition. They can start as early as 18 when they assign their ticket, all the way up to full retirement age. But really what Ticket to Work is a way for beneficiaries to tap into employment services to get the support they need to achieve their work goals. And really it provides a great wealth of choice in obtaining those services. It doesn't just have to be you're signing your ticket to the local vendor of the service provider. You can use a national one if you want to. It's totally free and voluntary. And I think that's a myth for a lot of people that we find, is that people think they have to assign their ticket in order to utilize any of the work incentives that we've mentioned, and that is not the case. You don't have to assign your ticket to an employment network to be able to utilize the work incentives we've been talking about. So it's a great way for somebody to tap into the employment supports that they might need, but they don't have to if they don't want to. Next slide. And just to mention, one of the biggest benefits for ticket is if somebody is really concerned about that continuing disability review, and that could be, somebody maybe had the 18 age termination, and now they're kind of concerned about what's happening next. That could be an option for them to have their ticket assigned and meeting timely progress as well. So just to give you guys a brief overview of how to connect beneficiaries to WIPA, we really encourage WIPA eligible beneficiaries to reach out to the Ticket to Work helpline. We're a small but mighty team that covers a lot of area, and the Ticket to Work helpline is a great way for us to have kind of help triage people coming in for WIPA services. And when somebody is connecting with the helpline, that person either has to be in transition age, youth age, or working to be able to get referred to us through the helpline. They evaluate the beneficiary's eligibility for WIPA. They assign that beneficiary to the correct WIPA project. As you saw, there's 3 different ones that cover Illinois, for example. So we want to make sure they're getting to the right folks that they need to. And we get an email directly from them with the beneficiary's information so that we can reach right back out to that beneficiary directly. And we're required to connect with that beneficiary within 5 business days of receiving that referral. So we try to keep that turnaround time as quick as possible. Next slide, please. So let's talk a little bit about what happens after that referral. And keep in mind, somebody can still reach out to us directly if they're just in that front part of the employment continuum. So maybe they're just starting to think about work, or maybe they've worked for a little while and they're not working now, but they're thinking about it again. They can still reach out to us. They just have to email us or call Disability Rights Iowa's Connect line, or they can go online and put in a referral request. They can still connect with us. And really, once we are connected with somebody, we have a beneficiary complete our program documents. And what we mean by that is a couple of releases and an intake sheet. And then we take that information and verify it with the different entities. That could be Social Security, could be Medicaid, could be Medicare, could be housing. We want to make sure we have a very clear picture for beneficiaries as we're helping them work the way through what it looks like when they're making the decisions about work. And we also want to make sure everybody's on the same page. So if somebody's working with a service provider, we really encourage them to let us know that they want the rest of the team in on that conversation as well. The more ears that hear this information, the better. Because as we all know, it's a lot of information. It can be kind of heavy. So we want to make sure everybody's on the same page. The other piece that happens next is then the community work incentive coordinator writes a a benefits summary and analysis, which outlines for that beneficiary their employment goal and how any earnings might impact their benefits or what is happening there. Excuse me. That CWIC, the beneficiary and their team will then meet together and develop kind of a follow-up plan for any critical touch points in the future. And that really can look different as depending on one, how we get the referral and what their kind of process is on their end. We can sometimes have to wait on Social Security for a week or so, depending on, we could sometimes meet before we get that information, speak in more general terms, and then once that information is back to us, we write the benefit summary and then give it back out to review. Next slide. So let's play a little game. Let's see if you guys have been listening over the last 45 minutes, hour, whatever it's been now. So let's see if we think this is a good WIPA referral or not. Feel free to put your answer in the chat. So you get a call that Bruno recently turned 18 years old and is applying for Social Security disability benefits. Bruno is also thinking about working. They want to know how much they can earn. Is this a good WIPA referral? What do we think? Put your answers in the chat. Give it a couple seconds. I see a couple yeses. Oh, Jim, I think you're the winner on this one. So let's look back at it. He's just applying for Social Security disability benefits. So Jim, you're right. This person would not be a good WIPA referral because he isn't receiving or approved to receive disability benefits yet. Once he is, right, Kara, he's not working yet. He's just thinking about it. So once he's approved for disability benefits, then he would be a good WIPA referral. Great job. Next slide. So in this scenario, you get a call that Sarah has inherited $20,000 and is being terminated from Medicaid and SSI for being over resources. Sarah's not working. Is she a good WIPA referral? What do we think? I think we're stumping people today, Jenny.
I think after the first one, they're like, I don't know.
We got a couple no's coming through. Well,
I
maybe
know there's 30 people here, so
yeah. I don't think we got him on this one. So you're right. This is not a good WIPA referral. Good job on the nose. Because this is an inheritance question and it's about the Medicaid and SSI. However, she's not working. So although we could probably answer this, not necessarily a good WIPA referral. Next slide. So in this scenario, we have Theo, and he tells us that he's just started a new job and he'll be earning $1,200 a month. Theo receives SSI and has not worked since receiving benefits. Theo wants to know if their benefits will be affected. Is this a good WIPA referral? What do we think? Whoa, they're popping through already. What do we think?
Kara's on it. I think she's like, I'm going to win.
I'm seeing him pop through. I'm seeing him pop through. Yes, absolutely. Good job. Good job. This is definitely a good WIPA referral. We want to be talking with folks when they're in this stage about what is going to happen if they have past work history, all of the different things that are here in this scenario. We definitely want to be talking about with them. Great job. Next slide. So in this scenario, Billy receives SSI and has been working for the past year and a half in a full-time position. Billy tells you that they have not reported their earnings to SSA and received a letter stating they have an overpayment. Is this a good WIPA referral? Kara's trying to win the lightning round over here. Oh, you're right, Jim. It is painful sometimes. That's for sure. Right. You guys are on it. Definitely. This is also a good WIPA referral. Because Billy's been receiving SSI and been working, all of those elements are there. And we definitely want to be talking about what could have maybe been applied for a work incentive that might help negate that overpayment. We'll be able to look back and see if maybe there was a subsidy or an IRWI that they could be using during that time. It's always this kind of conversation. We want to make sure everything's been looked at, every rock has been looked under before we get somebody to start paying their overpayment. Next slide. So on this scenario, Remy has had a disability since age 3. They are not currently working. Remy is interested in learning more about ABLE accounts. Is this a good WIPA referral? What do we think?
Maybe we finally stumped him, Misty.
I think we might have. We might have. Jim says not working. Bill and Kara say no. What are we thinking? Although I know that Jenny, Tammy, and I would talk about ABLE accounts all day long if somebody would let us do that. This is not a good WIPA referral. And you're absolutely right. Good job, you guys. This is because they're not currently working and we don't know if they actually have disability benefits. We know this person has a disability since they were little, but they don't necessarily have benefits. And that's something we'd have to find out before it would be considered a good WIPA referral. Next slide. Okay, we have Chase. He receives Medicaid and is interested in working. They do not receive disability benefits. Chase wants to know how their Medicaid eligibility will be affected. Is this a good WIPA referral? Some key spots in this.
I like Jim's thought.
Me too. Who else? Who else has some input in that? Actually, I think we got you guys because a couple of reasons. One, although that Chase receives Medicaid and he's interested in working, they're not receiving benefits or proved to receive benefits. So they wouldn't be a good WIPA referral in this case. However, we do get questions like this every single day, and we will try to reroute or try to answer these one-off questions if we can, or we'll tap some back into somebody who can better serve the specific question like this. Good try. Next slide. On this one, we have Luna. She's a sophomore in high school and receives SSI. They're interested in getting a part-time job to gain work experience. Luna and their parents want to know if there are any work incentives specifically for students. Is this a good WIPA referral? What do we think? There's the lightning fingers. Lynn's going with yes. Yes again. Love it. You guys are doing great. Yes, Jim. Yes, you are right. This is absolutely a good WIPA referral. This is the perfect scenario of a student who we want to be talking to. And we would love to have the opportunity to get into schools more often and talk to folks at this particular stage. Because a lot of times there's myths that come in that maybe Uncle Joe receives a benefit and they're saying that, oh, I can earn up to, $1,600 a month. And that might not necessarily be the case for Luna. So we want to make sure and get in that conversation early so we can give them all the information in a super clear picture of what it's going to look like for them as they're working and what possible work incentives can help them do that without a big impact on their SSI. Next slide. Good job, you guys. Nice job. Nice job. Next slide. So a few final reminders, then we'll open her up for questions. So like we mentioned early on, WIPA is not an employment network for the Ticket to Work program. However, we do refer out to the employment networks across Iowa and Illinois as well. We're kind of like Switzerland in that we will try to instruct the person on how to find those services and what covers their area, and then what really kind of services they're needing. We'll try to match them up and connect them on that point. Our WIPA project only supports Social Security disability beneficiaries who are interested in, actively looking for, or already engaged in work through either wage or self-employment. And that can be even in the beginning stages. If somebody's talking about, I really thinking I might want to go do DoorDash for a job and be my own business, we want to talk to them because self-employment is a whole nother animal when it comes to disability benefits. We want to be talking to students who are doing that part-time gig as they're going to school because we want to make sure they're having all their work incentives applied correctly so that it's a bigger bang for their buck. And then again, WIPA only provides support for individuals already receiving or approved to receive Social Security disability benefits. So we want to be talking to folks who already have that stamp of approval all the way through folks who've been having the benefits for years and years. We want to be talking to them. And I think one of the biggest ones that we get all the time, and we just wanted to make it a reminder one more time, is we don't provide support applying for benefits. Although we have some good tips and tricks, I'm sure, that isn't underneath our allowable services from Social Security. So we will try to point people in the right direction. Not a lot of places in Iowa do that other than a few attorneys, but we'll try to get you in there. Oh yeah. Great catch, Jim. Yes, SSI and SSDI. Probably a typo on there. We got to have one. Somebody's got to catch us, right? Next slide. But yes, great question. Both SSDI, SSI. And we wanted to make sure to give you guys some additional resources. So the things we've listed on this slide should be live links. And we're going to send this to Amy so that you guys have it and have this resource for you in the future. That's the way to find your local Social Security office. Also the Ticket to Work website. as well as the Red Book on employment supports. It's like the disability beneficiaries little Bible on the Social Security website, and they do update that annually. We've seen the ones for 2025 come out. You can also order those if you'd like to, a hard copy print. We've shared with you our Disability Rights Iowa website. A lot of great information about all of our focus areas on there. Disability Rights Iowa's YouTube channel. We have a lot of videos on there and also some vignettes that are specific to work incentives. So if you have somebody sitting at your desk and you want to talk with them for a quick minute to tell them what a past plan is, that's a great place to start, is on our YouTube channel. And then we also have a Facebook page, and we try to do some updates and different things that come out that we make sure to get out and share with folks. And just remember that if you take nothing else away from this today, that Social Security beneficiaries can work, and that includes students. And again, WIPA can work with somebody as early as 14 all the way up through retirement. So how about questions? There's our little shiny faces right there. The Ticket to Work helpline and our DRI line, where I mentioned you can also call that, and you'll get one of our intake awesomeness people, and they will get you to us as well. So we're going to open the floor for questions. I know that's a lot of information coming at you at a quick, fast pace.
Just to clarify, Jim, those two bullets, when we say quote Social Security disability benefits, that can either be Title II or SSI. So it's an umbrella. So either one of those programs can get connected with us, but they have to have one of those disability programs.
Yeah, thank you. Nobody has questions? Feel free to unmute to yourself and ask away.
I can't believe we stumped them. We answered all their questions, Misty. I don't buy that.
Well, don't get too excited, Jenny.
Good.
I do have a question. You talk about self-employment. What about non-work? Like, say I have somebody that wants to buy or start self-storage, like passive income, I guess. Like how, you know, or pop machines, you know, or they get the equipment and they just go and get, how would that be a good WIPA referral? Or where would they start with even looking into something like that?
Jenny, you want to take it?
I was going to say, to me, that sounds like self-employment still. Even if they're not having to like, I know oftentimes when we think of self-employment, like I think of my friend's husband who has his own HVAC company and he has to have a lot of inventory and he's driving everywhere. It could be something as simple as someone does have, you know, when you're, like you said, like a pop machine, maybe they don't have, you know, expenses every month. There's a lot of upfront costs. That's still under Social Security's umbrella of self-employment. So if there's any sort of, they're wanting to bring in money, whether it's from a wage job or pop machines or any sort of earning money, that's where we'd really want to talk to them, especially because it probably would fall under self-employment if it's not the typical, you're getting a paycheck regularly, or they're not planning to get a W-2. So I would say still connect them with us. And if for some reason it would be a really rare situation, it wasn't employment, we'd let them know. But what you shared, to me, that sounds like self-employment still.
Right, I would agree with that. And the other thing, just to kind of mention about self-employment, is Social Security looks at the earnings from self-employment differently than competitive wage employment when somebody's working for somebody else. So it's a conversation that gets a little complex, and we want to make sure that they have all the information that they need when they're thinking about gig employment or self-employment or consulting work and stuff like that. If they get a 1099 from a business, that's self-employment. So, you know, those are the kind of things we'd be talking about. Great question. Anybody else? Watch in the chat. If you don't want to talk, you feel free to put it in the chat. While you're thinking about your questions, I just wanted to reiterate that if you have folks that you are working with, or you know of somebody that's a student and you're feeling like having WIPA come into a conversation with their team, maybe at an IEP meeting, or if they're working with vocational rehabilitation and they need some support in that, please reach out to us because we're happy to either hop on a Zoom with the folks, or if they're in our, traveling distance that we are able to go, we're happy to come in and give information about this. If you're working with Project Search, for example, or one of the AEAs, I know Jenny and myself will be tabling at some resource fairs coming up. So if you're working with students or you have a student yourself that you're thinking might need to grab some information from us, come and see us at those tables. I'll be at the Mason City Clear Lake one coming up in April. Jenny will be down in Iowa City.
Marshalltown
Oh, that's so
and
close.
in Waterloo.
That's so close.
But if there are other transition fairs, or if you're thinking about doing a resource fair, whether this spring or sometime later this year, and you're trying to find people, we would love to come, especially we get a lot, up in the north because that's where we are. But if you're down south, southeast Iowa, southwest, we would love to come hang out, check out what your city has to offer.
Any other questions for us? We're just on lunch overload at this time. We love to see so many familiar faces. We're really excited to have you join us. And if you feel like there's more information or you want to take a deeper dive on any of these work incentives or a particular one, and just let us know. And we're happy to jump on a Zoom like this or come to your location and talk more about them. All right.
I think that's it, Misty.
And I think that's it. We will get this slide deck and a couple of transition specific materials out to Amy to share out to the email list. And a couple of those you can be watching for is the rental liability one. We didn't really touch too much on it, but we see it a lot where somebody who maybe is an 18-year-old who's still in school but lives at home, they might be running into some issues with seeing their SSI go down or not be at full amount. So rental liability is something we can talk about, and we'll make sure and send that with, as well as some other transition focus stuff. Yep, we'll get the slides out to you. Well, thanks everybody.
Have a good rest of your afternoon.